1. A 45-year-old male presents with central chest pain radiating to the left arm and shortness of breath. What is the most appropriate initial investigation? A. Chest X-ray. B. ECG. C. Troponin. D. CT angiogram. 2. A woman with type 2 diabetes presents with painful, burning feet. What is the most likely diagnosis? A. Diabetic neuropathy. B. Plantar fasciitis. C. Peripheral vascular disease. D. Morton's neuroma. 3. A 70-year-old male on warfarin develops a gastrointestinal bleed. What is the most appropriate initial management? A. Stop warfarin and monitor. B. Administer vitamin K and prothrombin complex concentrate. C. Start 4 fluids only. D. Perform endoscopy immediately. 4. A 3-year-old child presents with barking cough and stridor. What is the most likely diagnosis? A. Epiglottitis. B. Foreign body aspiration. C. Croup. D. Bronchiolitis. 5. A 55-year-old woman presents with fatigue, pallor, and spoon-shaped nails. Which lab finding is expected? A. High MCV. B. Low serum ferritin. C. High vitamin B12. D. High transferrin saturation. 6. Which antihypertensive is contraindicated in pregnancy? A. Methyl-dopa. B. Labetalol. C. Enalapril. D. Nifedipine. 7. What is the first-line treatment for moderate asthma in adults? A. Inhaled corticosteroids. B. Oral corticosteroids. C. SABA alone. D. Theophylline. 8. A patient on lithium reports increased thirst and urination. What is the most likely complication? A. Hypothyroidism. B. Hypercalcemia. C. Nephrogenic diabetes insipidus. D. SIAD. 9. Which antibiotic is most appropriate for uncomplicated UTI in non-pregnant women? A. Amoxicillin. B. Ciprofloxacin. C. Nitrofurantoin. D. Ceftriaxone. 10. What is a common side effect of metformin? A. Weight gain. B. Constipation. C. Lactic acidosis. D. Hypoglycemia. 11. A patient refuses blood transfusion due to religious beliefs. What should the physician do? A. Override and administer. B. Seek a court order. C. Respect the decision and document it. D. Ask the family to consent. 12. A 15-year-old seeks contraceptives without parental consent. What is the doctor's best course of action? A. Deny the request. B. Inform parents immediately. C. Assess competence and provide care if appropriate. D. Refer to a social worker. 13. A colleague smells of alcohol during clinic hours. What is the appropriate action? A. Ignore it. B. Confront them publicly. C. Report the concern confidentially to a supervisor. D. Call the police. 14. Which of the following is considered a breach of confidentiality? A. Discussing a patient case in an empty elevator. B. Reporting a notifiable disease. C. Informing a patient's next of kin with consent. D. Sharing anonymous patient data for research. 15. A terminally ill patient requests assistance in dying in a region where it is illegal. The appropriate response is to A. Refer for euthanasia abroad. B. Supportively manage symptoms and provide palliative care. C. Suggest herbal alternatives. D. Provide the necessary drugs discreetly. 16. At what age should average-risk individuals begin colorectal cancer screening? A. 40. B. 45. C. 50. D. 60. 17. Which vaccine is recommended for adults over 65 to prevent pneumococcal disease? A. PCV13 only. B. PPSV23 only. C. Both PCV13 and PPSV23. D. BCG. 18. What is the recommended daily folic acid dose for women planning pregnancy? A. 0.2 mg, B. 0.4 mg, C. 1 mg, D. 5 mg. 19. What is the most effective intervention to reduce smoking rates? A. Public bans on smoking. B. TV ads. C. Physician counseling and pharmacotherapy. D. Warning labels. 20. A 35-year-old man with a BMI of 32 is most accurately classified as A. Overweight. B. Class 1 obesity. C. Class 2 obesity. D. Morbid obesity. 21. A patient with lupus presents with new-onset hypertension and proteinuria. What is the most likely diagnosis? A. Lupus enteritis. B. Lupus nephritis. C. Hypertensive nephrosclerosis. D. Glomerulonephritis. 22. A 60-year-old man with a history of alcohol use presents with confusion, ataxia, and nystagmus. What is the most likely diagnosis? A. Delirium tremens. B. Korsakoff psychosis. C. Wernicke's encephalopathy. D. Hepatic encephalopathy. 23. A 30-year-old woman has tremors, weight loss, and palpitations. Her TSH is suppressed. What is the most likely cause? A. Hashimoto's thyroiditis. B. Graves' disease. C. Subacute thyroiditis. D. TSH secreting tumor. 24. A child with fever, conjunctivitis, and a maculopapular rash that started on the face likely has rubella. B. Measles. C. Scarlet fever. D. Roseola. 25. A man is found unconscious with pinpoint pupils, bradycardia, and shallow breathing. What is the likely cause? A. Cocaine overdose. B. Benzodiazepine toxicity. C. Opioid overdose. D. Alcohol poisoning. Applied Knowledge Test. The Applied Knowledge Test AKT is a rigorous, computer-based examination designed to assess the clinical knowledge of medical professionals, particularly general practitioners GPs in training. Typically used by institutions such as the Royal Australian College of General Practitioners (rcgp), the AKT evaluates a candidate's ability to apply medical knowledge in real-world scenarios involving diagnosis, investigation, treatment, and ethical practice. Covering topics like clinical medicine, population health, therapeutics, and evidence-based practice, the AKT ensures that candidates are prepared to make safe, informed, and patient-centered decisions. It plays a vital role in certifying readiness for independent clinical practice. Here are the top 5 beneficial uses of the sample exam. 1. Assesses clinical readiness. The AKT ensures that candidates possess the applied medical knowledge necessary for safe, competent, and independent clinical practice, especially in general practice settings. 2. Supports licensing and certification. It serves as a crucial component in medical licensing processes, e.g., rcgp fellowship, validating a doctor's ability to meet national standards of care. 3. Improves patient outcomes. By focusing on real-world clinical scenarios, the AKT promotes evidence-based decision-making, ultimately contributing to better diagnostic accuracy and treatment effectiveness in patient care. 4. Identifies learning gaps. The AKT highlights areas where candidates may need further study or clinical exposure, guiding targeted professional development. 5. Promotes professional accountability. Successfully passing the AKT demonstrates a commitment to clinical excellence and adherence to ethical standards, reinforcing public trust in healthcare providers.